All right, we continue now with our great American panel. All right, we're having a discussion here during the break, and so we're going over these numbers. Everyone says, well, 47 million Americans aren't insured. If you factor out the people that are temporarily uninsured or don't have health insurance, you know, on average 3 or 4 months, if you take out illegal immigrants, you take out young people 18 to 25 that choose not to get insurance because they want to save money, we're dealing with about 15 million people. Now, why would we change a system that is the best in the world, that has advanced care, prolonged life, and given us a better quality of life for 5% of the population?
Well, I would say 2 reasons, Sean, that we need reform. One is that we pay twice the amount as other advanced industrialized nations for the same care.
That is not true.
That has been found in every major study, easily accessible, you know, even via the internet. But the second reason is, again, I was bringing it before the break, since 2002, our premiums have gone up 80%, and healthcare profits for insurance companies have gone up 400%. That sounds like a monopoly to me. We need some market competition, and the government is exactly the entity to provide that.
But the CBO, and I'll throw this to the Club for Growth, even they said tens of millions of people will be forced out of the private system into the government system. Here's my solutions: tort reform, medical savings accounts, tax credits for people who can't afford it, so that they can get catastrophic insurance, which is the thing that most people are concerned about. None of these things are being discussed in any of the versions.
Get rid of mandates, let people shop over state lines. There's a whole bunch of But this isn't about coverage, Sean. This is about control. It's not about covering the uninsured. It's about government control of health care, and that's the dirty little secret.
Isn't that, let's focus in on that. Isn't this about government power? Isn't he right?
I don't think so.
No,
I don't think so. I don't think it's about, because I don't think the objective is for the government to take over. I think that it's a means that's a problem. We don't want this. Government should stay out as much as possible of health care, because look at Medicare. You know, you hear that it's a 3% overhead, right? Medicare. You know why? All they do is write checks.
Let me tell you why you're wrong. Let me tell you, in all seriousness here.
I think we agree on this.
No, we don't agree on this, because
I believe in private enterprise competing.
If the government controls this, it will change the relationship between the citizen and the government, where every American now has to, please, government, please give me this. And that fundamentally, everywhere it has been tried, it has failed. And I do not understand why anybody would put their faith in the government.
Look, I've spent time in the Soviet Union, okay? And I've been through their healthcare system, and it's terrifying.
How about Canada? How about Great Britain? How about France?
Well, Britain, but
Britain? Women with breast cancer can't get sick.
I wasn't defending Britain. I was talking about Moscow. But no, I really think that the issue, and this is where Chris and I totally agree, is that you got to have health insurance companies able to compete to lower the prices.
But they are competing. There is free markets right here.
Not really.
Yeah,
not really. There's too much government control of state mandates in the states. You know,
that is
you have to agree on that concept.
No, that's true. You wanted to add, Carol?
Well, I think that we need to deal with the rising healthcare costs, right? And if we don't have a really competitive market for healthcare, which I think we don't have, primarily because consumers have no idea how much they're paying for health care. They don't know what procedures cost. Just a basic fact about purchasing something.
And how about the tax credits? How about the portability issues?
I think those are great ideas.
And medical savings accounts.
And tort reform, you know, 1% of costs, that's not a big solution. Health savings accounts, yeah, promoting that as well as a public option, especially for catastrophic, is a good idea.
I think that 1% is a misleading number, because
it's an American.
Yeah, if you look at strictly torts related to medical malpractice, but when you think of all the defensive medicine that we practice in this country to try to avoid things, when you think of not being able to go to the root cause analysis of a medical mistake because you're afraid to create a record for a trial lawyer, that costs trillions of dollars. And
tort reform in Texas worked.
Yeah, no, there's no question.
You know, what people don't think enough about is the fact that private insurance companies, who they often hate, actually work harder at cutting costs. Medicare doesn't do any of that. Private insurance companies, they're incentivized to do it.
Medicare pays doctors 10 cents on the dollar. I mean, these guys can't even keep their offices open.
Well, yeah, they don't negotiate,
right? So you have a monopoly mandating it.
Well, I agree. The end result, if it's government takeover, is a terrible thing.
All right, great. Folks, this debate will not end. Good to see you all. Thank you for being with us. And that does it for us tonight.